Well, high blood pressure, or
Yeah.
hypertension is a silent killer that affects people of all ages and backgrounds. If you've had it, you know that you're at risk for heart disease or even a stroke.
And if you've been diagnosed or you think you might have high blood pressure, you might be eligible to participate in the local study forming now, receiving treatment and medication for free. Here to tell us all about it is Susan Angel of CNS Healthcare. Thank you so much for being with us again.
Thank you for having
me. Good to
me.
see you. Happy New Year.
Happy New Year.
How common is hypertension, and how does somebody know if they have high blood pressure?
Well, hypertension is one of the most commonly treated things. You know, people are coming in and out of the doctor's office all the time for it. So it's not uncommon. The thing that's an issue is that many people are walking around and they don't necessarily know that they have it. So sometimes people come in and they've been, oh, I've got this headache, it won't go away. I take Tylenol, it doesn't go away. Well, you check their blood pressure and it's through the roof, you know, and that's one of the things that people will have.
So what is the goal of this clinical trial for people who have hypertension or high blood pressure?
Well, particularly for this one, we're looking at a new medication, hopefully, obviously, that is effective, and then with fewer side effects. And so that would be the goal.
And how would somebody know walking in? How do they know if this is the right trial for them?
Well, the best way to come is to come in, and then you can sit down with the clinical team, and they'll look at your health history, your current blood pressure readings, your current medications, and kind of look at that and review it against the study requirements. And if all those things mesh pretty well, then they would be a good candidate.
And is there anyone that would not qualify for this trial?
Well, of course, people who have high blood pressure also have lots of co-occurring illnesses, and depending on the severity of those co-occurring illnesses, they may or may not be eligible. Again, it's just something that we need that face-to-face time with someone so that we can sit down and assess the full situation.
And what should people consider? You have a lot of different trials through there, but what should somebody consider before doing this trial or any of the other trials that you guys have to offer?
Well, the main thing is determining if it's a good fit. You know, I mean, there is a time requirement, but then also you're getting very excellent care at no cost, no insurance is required. Then you have to balance whether or not a placebo is something that you may be comfortable with. But even so, the trials vary in length, and we're always looking out for the person's health primarily. So if there's something that came up during the study where you couldn't continue to participate, we'd help you out. We'd get the situation taken care of. And even at the end of the study, a lot of times people will follow up with me for months until I can get them connected back in the community, still at no charge.
How does somebody get started in this trial?
Well, simply they can log on to our website. There's a place to make an appointment through there, or they can call and just simply make an appointment for a free evaluation.
And are there any other trials? You guys always seem to have quite a few different things going on right now.
We do, and we have a couple of trials for pediatric population. We're looking at childhood depression, as well as ADHD for our younger elementary school children, as well as adolescents. We've got different depression studies going on, as well as for folks who have bipolar disorder.
Can you be compensated for these trials? Can people receive money?
Absolutely. People who actually enroll in the studies, they receive a stipend for their time and travel. So it varies depending on the study, the amount that they receive, but they always receive something.
And you mentioned like insurance comes up sometimes. Is there a reason why somebody would need to have insurance coming into this, or is it just?
Absolutely not. We don't even look at it. We don't want to know about it. They don't need to have it at all.
Wow.
All right.
Yeah.
Well, Sue, thank you so much. We appreciate
Thank
your
you.
time here, your insight on all of this, and we want to thank CNS Healthcare for sponsoring this segment.
To find out if their hypertension trial is right for you, just call 904-281-5757 and make an appointment for a free 30-minute evaluation session, or you can also log onto their website, cnshealthcare.com. Remember, all their services are free and no referral or insurance is needed. We'll be right back.